Tropical medicine. Malaria. Malaria. Definition. Malaria is an acute febrile, infectious disease caused by a parasite of the genus Plasmodium and is normally transmitted from person to person by female mosquitoes of the genus Anopheles. Malaria is characterized by cycles of chills, fever, pain, and sweating. The historical record suggests malaria has infected humans since the beginning of mankind. There are 4 species of malaria parasites which affect humans, namely O. Plasmodium falciparum, O. Plasmodium vivax, O. Plasmodium malariae, O. Plasmodium ovale, O. Plasmodium knowlesiae. Of these, Plasmodium falciparum is the most virulent malaria parasite in the world and also the most common malaria parasite in Uganda. Signs and symptoms. Fever is the most characteristic symptom of malaria. The fever in malaria is intermittent, i.e., it comes and goes many times. 3 phases can be distinguished in a typical attack of malaria. The cold stage, it is when the patient feels cold and shivers. The hot stage, it is when the patient feels hot. The sweating stage, it is associated with sweating and relief of symptoms. Loss of appetite, weakness and lethargy. Tropical medicine. Malaria. Dehydration, splenomegaly. The following symptoms can occur in complicated and severe malaria: change of behavior, confusion or drowsiness, altered level of consciousness or coma, convulsions, hypoglycemia, acidosis, difficulty in breathing due pulmonary edema or respiratory distress syndrome, acute renal failure, severe anemia, cough, hemoglobinuria, oliguria with very dark urine, Coca-Cola or coffee color, jaundice, bleeding tendency, prostration, hyperparasitemia, hyperpyrexia, severe vomiting, transmission of malaria. Tropical medicine. Malaria. An illustration of the life cycles of malaria parasites. The life cycle of a malaria parasite. 1. Malaria infection begins when an infected female Anopheles mosquito bites a person, injecting Plasmodium parasites in the form of sporozoites into the bloodstream. 2. The sporozoites pass quickly into the human liver. 3. The sporozoites multiply asexually in the liver cells over the next 7 to 10 days, causing no symptoms. 4. In an animal model, the parasites, in the form of merozoites, are released from the liver cells and vesicles, journey through the heart, and arrive in the tropical medicine. Malaria. Or erythrocytes. This cycle is repeated, causing fever each time parasites break free and invade blood cells. 6. Some of the infected blood cells leave the cycle of asexual multiplication. Instead of replicating, the merozoites in these cells develop into sexual forms of the parasite, called gametocytes, that circulate in the bloodstream. 7. When a mosquito bites an infected human, it ingests the gametocytes, which develop further into mature sex cells called gametes. 8. The fertilized female gametes develop into actively moving eukaryotes that burrow through the mosquito's midgut wall and form oocysts on the exterior surface. 9. Inside the oocysts, thousands of active sporozoites develop. The oocyst eventually bursts, releasing sporozoites into the body cavity that travel to the mosquito's salivary glands. 10. The cycle of human infection begins again when the mosquito bites another person. Incubation period. The period between the mosquito bite and the onset of the malarial illness is usually 1 to 3 weeks, 7 to 21 days. Certain types of Malaria P, Vivax and P, ovale parasites can take much longer, as long as 8 to 10 months, to cause symptoms. These parasites remain dormant, inactive, or hibernating in the liver cells during this time. Unfortunately, some of these dormant parasites can remain even after a patient recovers from malaria, so the patient can get sick again. The situation is termed relapsing malaria. Diagnosis: black small square. Clinical signs and symptoms: black small square. Unfortunately, many diseases can mimic symptoms of malaria, for example, yellow fever, typhoid fever, respiratory tract infections, meningitis, otitis media, tonsillitis, skin sepsis, and even measles. Tropical medicine. Malaria. Black small square. The classic and most used diagnostic test for malaria is the blood smear on a microscope slide. That is stained to show the parasites inside red blood cells. Treatment. 1. Treatment of uncomplicated malaria. The recommended first-line medicine is artemether/lumefantrine cordim. First-line alternative treatment is Aetonate plus amidoquine, the alternative drug that may be used when artemether/lumefantrine is not available. The recommended second-line medicine is dihydroartemisinin plus piperquine, duocoxin. 2. Treatment of severe and complicated malaria. Perindoryl artesunate is the recommended treatment for the management of severe malaria in all patients. Parenteral quinine or artemether are the alternatives to be used when artesunate is not available. Establish an I-B line. Give fluids to correct dehydration according to body weight. 3. Treatment of malaria in pregnancy. Uncomplicated malaria. Plus first trimester, quinine tablets. Plus second and third trimesters, artemether/lumefantrine or quinine tablets. Severe malaria in pregnancy is treated with intravenous artesunate. 4. Antipyretic to reduce body temperature. Paracetamol 10/kg body weight every 6 hours in children. Adult 1 6 minutes 8 thully. Tepid sponging or fanning. 5. Anticonvulsants e.g. diazepam 0.1/kg body weight IV or IM in adults. 6. Treat detectable cause of convulsions e.g. hypoglycemia with dextrose. 7. Nursing care. Give supportive care and symptomatic treatment such as tepid sponging for fever. Observations of TPR and BP. Take temperature thoroughly and record all observations. Give health education regarding personal protection, prevention of malaria and compliance with treatment. If there is vomiting, patient should take an antiemetic medicine a half to 1 hour before taking the antimalarial drugs. The patient should rest for 1 minute to 2 hours after taking the medicine due to the risk of dizziness, vomiting and hypotension. Tropical medicine malaria. The patient should be given psychological support by encouraging the patient and giving comfort. Encourage a nourishing diet with plenty of oral fluids. If a patient is unable to eat or drink past a nasogastric tube, monitor fluid intake and output. Institute a fluid balance chart. Ensure proper hygiene of the patient as a whole and the environment. Complications. Impaired consciousness/coma. Severe anemia. Renal failure. Pulmonary edema. Acute respiratory distress syndrome. Shock. Spontaneous bleeding. Acidosis. Hemoglobinuria, hemoglobin in urine. Jaundice. Repeated generalized convulsions. Prevention and control. Give effective treatment and prophylaxis. Eliminate the parasites from the human population by early diagnosis and effective treatment. Protect vulnerable groups with chemoprophylaxis. The following drugs are used: chloroquine, doxycycline, methoquine, primaquine. Give IPT to all pregnant women. I'll reduce human mosquito contact. Use insect-treated nets. Destroy adult mosquitoes by spraying of dwellings with insecticides or use of knockdown sprays. Tropical medicine malaria.